I'm sorry that people are so jealous of me, but I can't help it that I'm popular.
Okay, but here's the twist. NPC, or nasopharyngeal carcinoma, is actually the one that's popular, and not in a good way. It is the fifth most common cancer in Malaysia, and we're just not talking about it enough. NPC, or nasopharyngeal carcinoma, is a type of head and neck cancer that originates in the nasopharynx, the upper part of the throat behind the nose, which you can see here. It's scary to think that such a prevalent cancer isn't common knowledge. I admit I didn't know much about NPC, but it's quickly becoming a significant health issue here in Malaysia. And even if it's not that common on a global scale, almost more than 83% of recorded cases are from Asia, and that's bad news for us. In Malaysia, this cancer is particularly common among Malaysian men of a certain demographic, namely of Chinese and indigenous East Malaysian origins, mainly affecting people from the age of 40 to 60. That doesn't mean that those who don't fit into this demographic should be ignorant, as they can also contract this disease. If it doesn't affect you, at least knowing about the cancer may help another person in getting diagnosed. Awareness is very crucial because it helps in early detection. And right now, almost 50% of the patients diagnosed are already at stage 4, mainly because the symptoms are very general and because many people don't know about NPC. Some symptoms that you need to watch out for are persistent nasal congestion, especially if it's one-sided, blood-stained saliva or nasal discharge, hearing loss, again, especially if it's in one ear, double vision, and neck lumps. If these symptoms persist for at least 2 weeks, please make sure to contact a healthcare professional promptly. But the exact cause of the disease is unknown, but there are several risk factors associated with NPC patients, and those are genetic predisposition, as mentioned before, a certain demographic, Epstein-Barr virus infection or EBV infection, diet, smoking, and alcohol consumption. So what does treatment look like for patients with NPC? Stage 1 patients respond well to radiotherapy. Those with stage 2 to stage 4 could have treatments with both radio and chemotherapy. But as the stages increase, it should be known that it will focus more on controlling the cancer. Some side effects of treatments include ulcers or sore skin. And the good news here is that with treatment, even stage 4 NPC patients can look up to a survival rate up to 50%. And this is why early detection is so important. Early diagnosis can lead to quick action and treatment, leading to higher survival rates. Understanding NPC's prevalence, risk factors, and symptoms is vital for early detection and treatment. Let's spread the word and support efforts to combat nasopharyngeal carcinoma in Malaysia. Remember, early detection saves lives. Spread the word about NPC and let's fight this cancer.